Welcome, medical students and clinical researchers, to today's explainer. Okay, picture this. A vial of the exact botanical extract we're talking about today was actually found buried in Pharaoh Tutankhamun's tomb. Pretty wild, right? Today, we're bridging the gap between those ancient historical remedies and modern, rigorous pharmacology. We're zeroing in on Nigella sativa. It's a botanical that's absolutely captured the attention of 21st century labs across the globe. Our main focus today? Understanding its primary active compound, Thymoquinone, and diving into the clinical implications of its remarkable botanical synergy. We're going to unpack exactly how a plant that's been used for literally thousands of years is offering some profound pharmacological advantages today. Let's get started. Okay, let's dive right into our clinical roadmap for today. We've got 1. Pharmacognosy and historical context. 2. Thymoquinone, the master regulator. 3. Systemic clinical applications. 4. Botanical synergy and pharmacokinetics. And 5. Clinical review questions to test what we've learned.
Section 1. Pharmacognosy and historical context. Before we jump into the hard pharmacology, we really need to establish this botanical's incredible pedigree.
Now, to truly grasp the clinical significance of this plant, we have to recognize its 3 millennia-old reputation. Think about that, 3,000 years. Out in the arid landscapes of the Middle East and Western Asia, the usage of this botanical was really perfected. In Arabic, they call it Habat al-Barka, which literally translates to the seed of blessing. And this title stems from an ancient prophetic tradition that famously claimed it to be, well, a cure for every ailment except death itself. I know, that sounds like massive ancient hyperbole, but it's exactly this kind of persistent cross-cultural reputation, by the way, it's also known as Kalanji in Hindi and Siadene in Persian, that actually sets the stage and provides the solid rationale for our modern 21st century lab research. So, from a biological standpoint, Nigella sativa is honestly a pretty modest plant. It's got these delicate, pale blue flowers. But the true medicinal magic? It's completely concealed within its fruit. When the seed pods dry up, they crack open to reveal these tiny, obsidian-hued grains. Now, as future clinicians, you really need to view these seeds not just as some agricultural product, but as an incredibly complex chemical factory. The clinically fascinating feature here is that this botanical produces a volatile oil that is entirely dominated by one highly specific, incredibly powerful compound, thymoquinone. Moving on to Section 2, Thymoquinone, the master regulator. Now, what's really interesting about this next part is that it's the primary active mechanism driving all the clinical data. So, in the field of pharmacognosy, you know that one of the absolute biggest hurdles we face is bioavailability, right? Lots of standard botanical substances look amazing in a petri dish, but the second they are ingested, their active components just get destroyed by the harsh acidic environment of human digestion. But notice the difference in stability here. While those standard botanicals are broken down, Thymoquinone, or TQ, is just radically different. It is highly stable. I mean, even when you compare it against certain synthetic drug compounds, it holds its own. And this stability is literally the key to its efficacy. It allows TQ to totally bypass those destructive digestive processes and actually reach the bloodstream intact. Once it's in there, it binds to cellular membranes to actively regulate cellular pathways, specifically modulating inflammatory cytokine pathways. Instead of just hitting a single target, it acts as a true master regulator within the human system. Section 3, Systemic Clinical Applications. Let's see exactly what this master regulator does once it enters the systemic circulation. The medicinal profile of Nigella sativa is just incredibly broad, basically confirming what ancient healers kind of already intuited. We're going to unpack 3 core systemic applications that you are highly likely to encounter in your clinical practice. Well, unless you're planning to hide out in pathology, of course. We're looking at its role as a bronchodilator for respiratory rescue, its function as an insulin sensitizer for metabolic mastery, and its really powerful action as an antibacterial and antifungal shield. Let's do a quick clinical vignette. Picture a 35-year-old patient presenting with chronic asthma exacerbations. Nigella sativa acts as a potent bronchodilator here. It's physically helping to relax the smooth muscles of the airways. And what makes this clinically fascinating is that it provides a level of relief that actually mirrors certain standard rescue inhalers and synthetic pharmaceutical interventions. But, and this is a huge but, it presents a significantly lower risk of long-term receptor dependency. So it's a really compelling alternative, or even an adjunct pathway for respiratory relief that definitely warrants serious clinical consideration. Next up, we have metabolic mastery. Imagine you have a patient presenting with prediabetes or metabolic syndrome. Black seed basically acts as a systemic insulin sensitizer for them.
By helping the body process glucose way more efficiently, it's directly targeting the actual underlying dysfunction that's driving the condition. And you know what else? Because it integrates so seamlessly into just a normal daily dietary routine, this kind of lifestyle integration can drastically improve your patient's long-term adherence to the therapy, especially when you compare it to those super complicated multi-pill synthetic regimens we often see. The third systemic application is its role as an antimicrobial shield. The volatile oil of the black seed possesses some highly significant antibacterial and antifungal properties. But listen, the most vital takeaway here is its efficacy against those notorious antibiotic-resistant strains. Research has actually shown it successfully combats pathogens like MRSA. No way, right? In an era where antimicrobial resistance is literally one of our greatest clinical threats, having a botanical agent that can break through those heavily fortified microbial defenses is just an invaluable asset for us. All right, Section 4, Botanical Synergy and Pharmacokinetics. Let's shift gears and examine how this plant actually integrates with and protects the body against other pharmaceutical protocols. And this brilliantly illustrates the defining concept of the synergistic advantage. Think about standard laboratory-created synthetic pills. They're typically formulated with just a single active molecule that's been designed to hit one very specific physiological target. But black seed operates on an entirely different paradigm. It contains over 100 different compounds that work together in synergistic harmony. It's like a symphony of compounds, and this synergy allows us to achieve much broader therapeutic effects while simultaneously outlining a method to actively minimize the toxic off-target effects we so often see when high-dose synthetic interventions are used in total isolation. When we look at the data on organ protection, this synergy gives us a massive clinical advantage. Think about a patient undergoing aggressive chemotherapy or taking heavy systemic antibiotics. Collateral damage to the kidneys and liver is always a major clinical concern there, right? Well, research indicates that black seed oil acts as both a nephroprotective agent, meaning it actively shields the kidneys from toxic insults, and a hepatoprotective agent, defending the liver from those heavy drugs. It offers this absolutely vital protective buffer for organs that are undergoing immense chemical stress from harsh pharmaceutical regimens. So, when you're discussing herbal integration with patients during your routine consultations, here is your clinical pearl to remember. Black seed oil functions exceptionally well as a carrier. Because of its really unique fatty acid profile, it actively enhances the absorption of other fat-soluble nutrients directly into the systemic circulation. This means it doesn't just heal on its own, it actually increases the bioavailability and the efficacy of other co-administered medicines. It's just an incredibly powerful adjunctive tool to maximize the absorption of whatever therapeutic regimen your patient is already on. Finally, Section 5, Clinical Review Questions. Okay, time to wrap up this briefing and test your retention with 3 rapid-fire, board-style clinical scenarios based on the data we just covered. Question 1. Think back to the very beginning of our systemic breakdown. What specific pharmacokinetic property of Nigella sativa's volatile oil allows its primary active compound, Thymoquinone, to exert systemic effects, unlike so many other botanicals? Okay, the key takeaway here is its high molecular stability. Unlike standard botanicals that just get degraded and destroyed by the harsh acids of human digestion, TQ is highly stable. That allows it to successfully bypass digestion, reach the bloodstream, and bind right to those cellular membranes to act as a systemic master regulator. Moving on to question 2. Imagine a patient on a heavy, potentially toxic antibiotic regimen who is co-administered black seed oil. What 2 specific organ protective properties is the physician attempting to utilize here? Take a guess. Based on the clinical data, the physician is aiming for its nephroprotective and hepatoprotective advantages. They are actively trying to shield the patient's kidneys and liver from the toxic insult generated by those heavy antibiotics or chemotherapy. And our final question. How does the botanical synergy of Nigella sativa functionally differ from a standard laboratory-created synthetic respiratory drug that targets airway smooth muscle? Well, a synthetic drug relies on one isolated molecule designed for a singular target. But Nigella sativa, it utilizes a harmonious symphony of over 100 synergistic compounds working together. This provides relief with a much lower risk of dependency while simultaneously protecting vital organs. It fundamentally changes how we can view systemic treatment. So, as future clinicians navigating an incredibly complex era of antibiotic resistance and metabolic disease, the question isn't just whether we should look back at ancient remedies. Rather, the real question is, Are we finally ready to prescribe nature's synergy right alongside modern synthetics?